According to the World Health Organization, 24% of all estimated global deaths are linked to environmental factors. That's nearly 1 in 4 deaths worldwide caused by something in the environment, such as air pollution, unsafe water, or inadequate sanitation. This statistic does not account for contagious diseases that other humans, animals, and insects spread in our environment. I'd like to share findings from my latest research, which employs artificial intelligence and geospatial data to forecast disease outbreaks across Africa. Imagine addressing public health issues by utilizing advanced technology to survey extensive areas and anticipate where diseases like malaria or cholera may occur next. This is precisely what our research aims to accomplish. We operated on a grand scale, analyzing data throughout the African continent while maintaining individual districts. Our objective was to uncover patterns, anticipate outbreaks, and equip public health experts with tools for effective responses. I had the privilege of collaborating with incredibly talented individuals at the World Health Organization who are deeply engaged in humanity's vital challenges. So let's examine what we achieved and discovered and understand its significance for science, business, and the tangible impact. So, how do you predict disease spread across such a vast region? We started with WHO's Integrated Disease Surveillance and Response System data, or IDSR. This dataset tracks weekly suspected cases of malaria, cholera, meningitis, yellow fever, lots of other diseases, down to the individual district. But disease isn't just about cases. It's influenced by the environment. So we added supporting data like climate variables, population density, land cover. For instance, we looked at NASA's precipitation and temperature data. We even used OpenStreetMap data to study how close people live to water bodies, which can significantly affect disease transmission. Our approach combined traditional spatial analysis with artificial intelligence machine learning. First, we used techniques like Moran's Eye and LISA to find geographic patterns and relationships, such as hotspots where diseases are clustered. Then we built machine learning models to predict whether a district would see cases in a given week. We tried several models like random forest, like GDM, even deep learning models, and used AutoML to choose and optimize them. Finally, we examined which factors were most important for prediction. Elevation, tree cover, especially population density, and time consistently stood out. This combination of tools lets us dive deep into the spatial and temporal aspects of disease spread. Now, let's talk about the results. One of our key findings was that spatial proximity matters. Districts near other districts with disease cases were likelier to see instances themselves. This was especially true for malaria, where we saw the strongest clustering pattern. The local spatial autocorrelation, or hotspot analysis, revealed distinct geographic patterns for each disease. For example, malaria hotspots were concentrated in tropical climates. In contrast, yellow fever hotspots were predominantly in savanna regions. This highlights the influence of environmental and climate factors on disease distribution. We'd like to explore some interesting areas in the future, like near the Great Lakes of Africa. Around here, there was really distinctive hot and cold regions and outliers. Our machine learning models had mixed success. The most accurate predictions with an F1 score of 0.96 were for malaria, which had more balanced data and strong correlations between features. However, the model struggled with diseases like cholera and yellow fever because the dataset had fewer positive cases, making the data imbalanced. Still, the models helped us uncover some fascinating insights. For example, time emerged as a critical factor, suggesting that disease patterns follow seasonal or cyclical trends. Climate variables like precipitation and temperature were also important. Finally, population proximity to water bodies significantly affects diseases like cholera and malaria. These findings confirm that spatial and environmental data, combined with AI, can unlock powerful insights about disease dynamics. So, why is this important? First, our research shows that predicting disease outbreaks locally is possible while analyzing an entire continent. This is a huge step forward because most studies in the past focus on small areas or use aggregated national data that misses local details. Second, the tools we developed are scalable. Given disease data for the entire world, we could scale the methods globally. That means they can be applied to other regions or diseases and produce results quickly. Imagine being able to rerun this analysis in real time during an outbreak or a humanitarian crisis. Third, it is essential to emphasize that machine learning is a powerful tool for making accurate predictions about disease outbreaks. It plays a crucial role in identifying the key variables influencing these events. Machine learning models can reveal the most critical environmental, socioeconomic, or demographic factors by analyzing feature importance and providing actionable insights for public health strategies. Additionally, these models enable simulations that allow decision makers to test what-if scenarios, such as how climate changes, population movement, or interventions like vaccination campaigns might impact disease spread. This ability to combine prediction, variable discovery, and simulation makes machine learning an indispensable tool for data-driven decision-making in public health. That said, there's room to improve. For example, we didn't include time series modeling, which could enhance predictions by capturing how diseases evolve. Even with the hotspot analysis, we aggregated the data. If we performed hotspot analysis while maintaining the weekly cases, we could produce more detailed changes over time for analysis and even identify differing types of hotspots, such as growing, diminishing, or sporadic hotspots. We'd love to incorporate additional datasets like human mobility patterns or vaccination coverage to get a more holistic view of disease spread and incorporate variables that are more readily controllable by humans for improved resource allocation. For the implication of our research, let's break it down to 3 areas: science, business, and the real world. For science, this study advances epidemiological modeling by combining geospatial analysis with machine learning. It also sets a precedent for using automated machine learning, or AutoML, in public health research. Past research in this area has either focused on a small geographic area or aggregated data from countries for larger regions for the global analysis. For business, there is a clear opportunity to develop commercial tools. For example, insurers could use these models to anticipate risks, and pharmaceutical companies could use them to plan resource distribution in outbreak-prone areas. For the real world, this research equips governments and NGOs with better tools for planning and responding. We can allocate resources more effectively and save lives by pinpointing high-risk areas and understanding key factors. To conclude, this research demonstrates the power of geospatial AI in tackling one of humanity's biggest challenges: disease outbreaks. By combining traditional spatial analysis with machine learning, we've shown that accurate predictions at a local level across vast areas is possible. While there is still work to be done, this study lays the foundation for more innovative, faster, and more scalable public health solutions. I hope it inspires collaboration and innovation in this space, as the stakes couldn't be higher. If you found this interesting, let's continue the conversation. I'd love to hear your thoughts or discuss how to develop this work further. Please stay tuned and follow me. In my next video, I'll get into more detail on how we did what we did, what were the research choices we made, what are some things we would like to do given more time, and what methods might be even more promising in the future given some technical or data advances. So thank you so much.